A local family is demanding answers after their 3-year-old needed emergency brain surgery, but the system that is meant to help couldn't.
Pediatric units were full, air crews grounded, and transports were unavailable. News 13's Jennifer Emmert investigates the gaps that expose vulnerabilities. She underscores why every family with specialized health care needs should have a plan B.
She's one of a kind. She is very vocal, but she doesn't get her way. Very outgoing and wild. Hey.
When 3-year-old Amelia Prater wasn't herself in mid-October, her parents knew something was wrong.
She was throwing up, nauseous, and just really tired that day.
A CT scan at Blue Ridge Regional Hospital in Spruce Pine flagged a life-threatening concern.
Her shunt was dislodged out of the spot it's supposed to be.
Amelia suffered a brain bleed and blood clot at 3 weeks old.
That caused her ventricles to swell, giving her the hydrocephalus, which is why she has the shunt in her brain.
Amelia needed a pediatric neurosurgeon, but Mission's pediatric unit and ICU were full and the hospital doesn't have one on staff. Levine Children's Hospital in Charlotte was the nearest option, but weather grounded air transport.
Pretty much wings, atrium, the med center area down there, I guess, and Mama all refused to fly.
That left a ground transport, and Mission's Blue Ridge crew was already out on a long-distance run.
That's pretty much when the nightmare started.
Mission's Medcom team coordinates transport for the health system. EMS directors say they weigh several factors.
What's available, what the capabilities are, and then can that local service handle the impact to their 911 side or their general regular services to lose a truck for 8-10 hours.
And I uncovered overnight resources are limited both for interfacility transport and 911 calls.
A lot of our western counties run 2 to 3 ambulances during the day and may drop back to 2 at night, and so they have a limited resource.
It's the same for Mission, which has more transport units today than 5 years ago, including a second air base in Franklin. But in the early morning hours during Amelia's emergency, without an available transport, Medcom reached out to other county EMS vendors. So did hospital staff.
The doctor was on the phone calling the nurse, her nurse, the charge nurse, and other nurses on the floor. They were all on the phone trying to find somebody that would take and transport.
Smaller EMS agencies in Yancey and Mitchell County could not ignore 911 needs, their main responsibility.
A smaller EMS agency like us, that's a minimum of a 6-hour turnaround time, so that's just way too long to take a local resource away.
North Carolina rules specify training requirements for ambulance staff, but there are no regulation around the number of inter-hospital transports, leaving the Praters with a tough decision: risk waiting or drive Amelia themselves.
And the nurses and the doctor that night were amazing. As soon as we walked out the door, I was like, just praying the whole time that we could make it there.
5 minutes from Charlotte.
She woke up just vomiting constantly, and thankfully we were right there at the hospital.
Rushed into surgery, the shunt was replaced.
She's my world. And like I said, that was probably one of the scariest nights of my life.
According to EMS directors, the Praters aren't alone.
I couldn't give you a number, but I know that that has happened in the past.
The family filed a complaint with Mission Health System and the state.
They need to make the changes, and the right changes, to where this doesn't happen again to not just us, but anybody.
In Mission's letter to the Praters, the hospital said it's reevaluating its bed capacity and apologized for the transfer experience, claiming extensive efforts were made. In a statement to me, they point out certain events like inclement weather are out of our control and may prevent or delay emergency service vehicles from operating as usual. Yancey County raised the issue at a recent peer review meeting.
When instances like this come up, we will bring that to their attention and hope to have some open dialogue on what they're trying to come up with to rectify the situation.
EMS emphasizes that families should be aware of potential gaps in specialized transport care.
Unfortunately, we do hear the stories of that happening. The goal would be that they would have a continual care during their transport. But ultimately it's up to the patient, their family, their guardians to make the decision what's the most appropriate in the time and the resources that are available.
Yancey County's EMS director said they're advocating for a policy change when it comes to contacting outside air medical resources. It's an issue we'll continue to follow, and we want to hear about your healthcare concerns. Email iteam@WLOS.com.